invite Dr. Naintara CHOUHAN. Yeah, and she is going to, her paper is Sensory and Motor Outcomes After Surgery in Intermittent Divergent Squint. Meanwhile, Dr. Marushka Aguar is here. Yeah, you can join on the other podium. Yeah, Dr. Naintara, please.
Good morning, everyone. I'll be speaking on the topic sensory and motor.
Mic, come closer to the mic. Yeah.
Good morning. I'll be speaking on the topic sensory and motor outcomes after surgery in intermittent divergent squint. So IDS is an exodeviation which is controlled intermittently by the fusional mechanisms. Out of all the exotropia, IDS comprises about 50 to 90% of the cases, and it is preceded by a stage of exophoria. So with the progression from exophoria to exotrophia, there is ongoing deterioration in the stereoacuity. And the clinical severity is measured using the Newcastle control score. So our primary objective was to see the distance in near stereoacuity, and the motor outcomes were seen using Newcastle score and fusional versions. And secondary objective was to correlate the sensory and motor outcomes and to compare these parameters between cases and controls. So 34 cases and 34 controls were taken, and the subjects were examined on day 1 month, and 3 months after the surgery. These were the inclusion and exclusion criteria. So coming to the results, when we compared the cases and control, there was a in cases, the stereoacuity was significantly lower as compared to the controls in near stereoacuity and on distant stereoacuity. And after surgery, we saw that there is a significant improvement at 1 month post-surgery, and then it continues to improve over the next 3 months. But even at 3 months, it was significantly lower than the control in near and distant stereoacuity. For motor outcome, it was drastically improved at 1 month post-surgery, and it was maintained over 3 months. Near fusional convergence, that also improved significantly. And to see the correlation between the motor and sensory outcomes, we saw that the correlation was better in preoperative period as compared to post-operative period. And pairwise comparison showed that there is poor gain in stereoacuity if the surgery is done when the Newcastle score deteriorates beyond 5. So the main conclusion was that cases which had modified Newcastle score more than 5, they had poor prognosis in terms of gain in stereoacuity if the surgery is done later. So surgical intervention should be planned earlier before the stereoacuity, before the Newcastle score deteriorates beyond 5 in these patients. Thank you.